Welcome back, everyone. Back pain is something that affects tens of millions of Americans, but there are new guidelines now to help you with all that pain. So opioids for back pain can be addictive, and then you have NSAIDs that can cause long-term effects when you take them through your mouth. So what can you do about it? Well, let's join right now Dr. Bob Arnot live to tell us more about new recommendations. Good morning to you. And this recommendation sounds to me about as simple as it gets, but it's effective. Tell us more about it.
Well, so the key thing is that you have these huge organizations representing 300,000 physicians. That is the American College of Physicians, which I belong to, in the American Academy of Family Practice. And, you know, in many other countries around the world, people have always used what we call topical medications. That is something you put on your skin, whether it's a gel or a cream or a patch. And we in the United States have sort of been fixated on taking a pill. So what it's recommending is as first-line therapy, that is the very first thing you go to when you have these kinds of pains, is a topical therapy. It's based on very good evidence. It's based on 13 million U.S. insurance claims. So you can take it to the bank in terms of being, you know, a very good advice. And you know, Melissa, two reasons why I think this is important. First of all, it's a great way to avoid opioids. The same study found out that, you know, if you start with an opioid, and you're a high-risk person, there's a 27% chance you're going to continue to be addicted. So that's incredibly important. And then the other thing with the study is that it just turned out to be more effective. That is, you are less likely to have pain and more likely to be functional if you use the topical medication as opposed to an oral.
That is huge, and I'm just so happy that there is something available now that seems to be working. Like you said, it's effective. Now, if it's still an NSAID, what's the difference between taking it by mouth and it goes into your stomach versus it going, I guess, directly into your bloodstream if you do it topically?
So, Melissa, it's such a great question, because if you take an oral medication, it goes into your stomach, and these NSAIDs, such as ibuprofen as an example, there's something like 15,500 people who die every year from these drugs, and that's because they can cause a stomach ulceration or bleed or stroke or heart attack. I mean, it's serious stuff. Whereas when you look at the topical, you have roughly 3% of that amount that will get into your bloodstream. So very, very little. And, you know, if your pain is right here, it's going right exactly there. You're concentrating all this drug going right through the skin and right there to that area, rather than going all throughout your body. So incredibly important in terms of avoiding the side effects. As doctors, we say, first do no harm. And with the topical formulations, there are virtually no serious side effects. And I've looked through all the literature. And so it's a great chance to get a good result without putting yourself at risk. And, you know, Melissa, very important in this whole COVID era, you know, look at, if you have a heart attack or stroke, you definitely want to go to the hospital. The hospitals are safe. But if there's some way you can avoid that, if it's, you know, fairly minor and you don't think you're in trouble, this is something you can do at home, which is wonderful.
All right. Well, it's fabulous news to share with us. Thank you for your time this morning, Dr. Arnot.
Oh, you're very welcome. And you can get more information at us.hisamitsu. Has all the information right there.
All right. We appreciate your time. It's 9:43 right now. An opportunity